Hello. So you are listening to a new podcast at The Lancet called The Lancet Pulse. My name is Chloe Wilson. I'm a senior editor at The Lancet, where I've been for just over 4 years now, but I came from general practice before then. And I'm joined by 3 other editors with me. Would you all like to introduce yourselves to our listeners?
Sure. Thanks, Chloe. I'm Matthew Gilbert. I'm the North American Clinical Acquisition and Outreach Editor, and I just celebrated my
It's a
third.
long title now.
I know. It was changed right before we started this podcast. I didn't consider how often I'd have to say it out loud. But I'd celebrated my 3rd anniversary with The Lancet on January 19th.
Amazing. And Jonathan?
Yes, I'm Jonathan Pimm. I'm a senior medical editor at The Lancet. I've been here for nearly 9 years now. And I also do a bit of part-time work for the NHS.
The most experienced among us, Jonathan?
Yeah, I'm not sure about that. I think everyone has different skill sets. Mine just happens to be, well, I suppose longer. Let's put it that.
Thanks so much, Jonathan. We've also got Ben with us.
Hi, I'm Ben Abbott. I'm an executive editor at the Journal. I've been here for about 1.5 years now, but was an editor elsewhere beforehand. And before that, I was a scientist, a kind of basic and translational scientist in cancer research.
Thanks, Ben. So the newbie of the group.
Yeah, sort of.
So why are we doing this podcast? So you hopefully might have listened to some of our other podcast offerings, The Lancet Voice and In Conversation With. And those podcasts tend to have guests who have published with us. So they're usually related to content that we've published in the journal. And we felt that there was more of an appetite for us to discuss more clinical topics, particularly those that are hot topics in medicine that might not have related to something that we've published yet, because there are many areas that perhaps, there might not be big randomized control trials, for example, that have made it into the Lancet, but they are making big leaps in various areas that are really important to know about. So that is why we've done this podcast. And really, format is going to be with various different editors, bringing in those guests and kind of breaking down that topic for our listeners.
Well, yeah, I was just going to say, in this day and age, obviously we recognise how incredibly busy you'll all be as researchers and academics and clinicians, and how pressed for time you all are in terms of, while you're trying to treat patients, train, teach or study or travel to meetings and so on. So it can be really hard to find time to read, reports or reviews that are several thousand words long. So we hope that these podcasts would be an informative and more digestible and accessible way to learn and to get some of the latest updates from trusted experts.
Thanks so much, Ben. So we'll be aiming to deliver a new podcast for you at least once a month, and they'll be about 40 minutes long. So Matt and Jonathan have actually just recorded a podcast for us, and that's on psychedelics. Do you want to tell or give a brief taster as to what the listeners can expect?
Sure, thanks. Yeah, Jonathan and I had the opportunity to interview 2 experts about psychedelic-assisted therapy. And while we began the conversation assuming that we would hear a lot about neurochemistry and hard endpoints and MRDS scale ratings and all that kind of stuff, we actually had quite holistic conversation regarding the utility of psychedelics to open a patient's heart, as Dr. Rachel Yehuda from Mount Sinai phrased it, to help them not just get a handle on whatever mental health issue might have brought them to therapy, but also to examine how and why they think about the world and their place in it, and overall bring I guess the idea is to bring a greater clarity and calm to existence beyond specific indications or diagnoses. We talked quite a lot about the value of community and kind of the village that supports journey through healthcare and disease, and the ability of psychedelics to augment that in a way.
Yeah, well, look, I did find the whole thing particularly exciting. It brought the rather sort of dull research type of paper to life with the experts that we managed to talk to. We had free reign, and they had free reign to talk far and wide about the issue. And I think that's where we'd like to focus in our podcast here. It sometimes is quite difficult to read all these thousands of papers, and sometimes it's better to hear from an expert who's just essentially talking off the cuff about these things.
Yeah, absolutely. I mean, thanks so much both. And we've also got 2 other podcasts for you. So we've got one on xenotransplantation that I recorded, which hopefully you find to be a good listen. And then we've also got one from Ben.
Yeah, so we have an episode coming up on the emerging role of AI in pathology with 2 experts in the field, both experts in terms of the clinical application, but also the kind of underlying computer science. And this is the field of computational pathology, the idea that, AI, when used in pathology, can not only make things, easier, faster, more objective, but also can often see patterns in medical images or pathology slides or images that the human eye can't see, and can therefore, reveal new things about disease biology or predict things, for example, about patient outcomes. I think it's really, fascinating stuff. And I do think pathology is one of the areas in clinical medicine where I think we stand to make the most gains from AI and can do so quite quickly. So yeah, I'm really quite excited for the potential of AI here.
Thanks, Ben. And for our listeners, Ben is our resident AI expert amongst us editors. So he's often the one that we'll go to with a query. So we really hope that you enjoy listening to these episodes from us. And this certainly isn't the last that you'll be hearing from us. So is there anything else, Matt, Jonathan, or Ben, that you wanted to add as we wrap up this intro episode?
Only that I'm realizing now I just said MDRS scale instead of MADRS scale.
Don't worry, I'm sure I'll forgive you.
Particularly that we could address on a future episode, maybe.
Thanks so much.
Thanks.
Okay.
And we're really looking forward to the new format.
And, if any of our listeners do have suggestions for things we should cover, feel free to reach out to us.
Yeah, absolutely.
And like and subscribe and all that, the podcast boilerplate.
Exactly. You can definitely like and subscribe and send us suggestions to our editorial inbox.
Thanks for listening to this episode of the Lancet Pulse, part of the Lancet Group podcast offering. Our editorial team includes Chloe Wilson, Ben Abbott, Matthew Gilbert, and Jonathan Pimm. Production and editing are by Matteo Simonetti. Subscribe to the show on your favorite platform to stay updated on new episodes. Thanks for being with us.